Hello and welcome back to GP Video Podcast by Nadia. So, after a very important topic of fatigue, now I have chosen to pick another very common presentation to general practice, which is called dizziness. So, dizziness is a very common presentation in general practice. However, the symptom of dizziness represents a spectrum of pathology from benign to serious, like from being non-serious to serious. So, as I had said in my fatigue video podcasts, that fatigue is a symptom complex and can be presented as many symptoms, both mental and physical fatigue. And then the causes are also under the 4 classifications that I had told you about fatigue, that there are so many factors from each group, from each class contributing to be the cause of fatigue. Similarly, dizziness is also a very common presentation, and it actually can be categorized again into 4 categories because there are 4 categories causing a sensation of dizziness. This time it's not the causes in these 4 categories, but because dizziness itself, the term is very vague and can be perceived differently by different patients. So what that term actually means is categorized into 4 categories, and then those categories have their causes in different subcategories. So I would like to read a bit of this Australian family physician article for you. It says, dizziness is a common presentation in general practice. However, the symptom of dizziness represents a spectrum of pathology from benign to serious. So dizziness can be a symptom of one of 4 conditions: vertigo, presyncope, disequilibrium, and number 4 is lightheadedness. So there are 4 conditions that a person or a patient or any of us can describe as dizziness. This is vertigo. Please remember, it's very difficult to understand otherwise. So please try and memorize these 4 categories. So it's vertigo, presyncope, disequilibrium, lightheadedness. 4 of these different categories or conditions can be perceived or can be presented as dizziness. Okay. It is often unclear what patients mean by dizziness, as they use this term loosely. Hence, clinicians must be vigilant in evaluating patients presenting with dizziness and be mindful of red flags that may indicate serious pathology. Okay. So, careful history taking and physical examination are pivotal in evaluating patients presenting with dizziness. Again, it says that dizziness is a common presentation that accounts for about 5% of primary care visits. When a patient describes dizziness, it can reflect one of 4 conditions that I have already said. Unfortunately, patients tend to use the term dizziness loosely. So now I would again want to tell you what are the 4 conditions or 4 categories causing a sense of dizziness: vertigo, presyncope, disequilibrium, lightheadedness. Okay, so now we'll start with vertigo. What is vertigo? Vertigo, basically in common men term, we can describe it as a spinning sensation. So either the patient would describe that his own body is spinning, or the room around him or the surroundings around him is spinning. Either of them is vertigo. Okay. So basically, if you want to say what is actually vertigo in a common men term, it would be spinning sensation. When I say common men, it means non-medical people. Okay. Then number 2 is presyncope. Presyncope is fainting sensation. Okay, so vertigo was a spinning sensation. Either your body is moving or the environment is moving. Number 2 is presyncope or fainting sensation. Number 3 is disequilibrium or imbalanced sensation. And number 4 is lightheadedness, sensation of disconnection from the environment. Okay, so in this podcast, I would like you to memorize these 4 with me: vertigo, So dizziness is a loose term, and I think we all have felt dizzy at some stage in our life. What are the four conditions, four basic conditions or categories causing a sensation of dizziness? Number one is vertigo, spinning sensation. Either the body is spinning, either my body is spinning or the environment is spinning. Number two is pre-syncope or fainting sensation. Number three is disequilibrium or imbalance sensation. And number four is lightheadedness or a sensation of disconnection from the environment. Okay, so we'll talk about these four categories more in detail next time. Have a good night.